to 11,000 that are dead across the United States. Of that nearly 11,000, or whatever the number is right of today, let's say 11,000, the city of Houston accounts council members for 11 of that number. And then closer to home, the Chief of Staff of Councilmember Tiffany Thomas, her father, the Chief of Staff father passed away in Louisiana. And so we certainly want to extend our prayers and condolences to the Chief of Staff of Councilmember Tiffany Thomas. In fact, we just got that text a few minutes ago. The person who represents our 11th death, unfortunately, in the city of Houston, was a young man. He died in his 30s with underlying health conditions. So this was a person in his 30s with underlying medical conditions, and he passed away on April the 1st of this year. So again, that brings our number of people who have died as a result of COVID-19 inside the city of Houston to 11. And the number of new cases that we're adding today is 175, which brings the total count to 1,320. We certainly know that there are more cases out there, and the testing has not been as robust as we would have liked it. Our goal continues to be to blunt the progression of the coronavirus and prevent an overwhelming demand on our healthcare system. And we are accomplishing that based on the data that we are reviewing. So whether you look at the number of ventilators that are available, those that are being used, the number of IC beds that are being utilized, the number that exist, the general admission beds in our hospitals, we are still within our hospital, the healthcare delivery system ability to care for those patients that are needed to be attended to. That's the goal. That's the goal, is to stay within their ability to provide the care to each and every person who requires it. And it's going to require all of us to continue to engage in social distancing, even more so in the month of March, to continue to wear your face coverings, even if you're asymptomatic, to stay home, to be mindful of when you're away from your homes and the grocery stores, to engage in social distancing, laundromats, you name it, when you're in the parks, all of that. But this is a very important month across the country, but especially for those of us in the city of Houston. This is a very important month because in a few days Passover is starting, and then at the same time this is the Good Friday and Easter Sunday coming up, the weekend. So for those, this is a very important month. So please be mindful of the fact that social distancing, whether you're at home or in the park or in the grocery store, is still needed. I do want to say something because we're now into 4-digit sort of numbers. Yesterday when we reported 1,145 cases, I do want to kind of give a little bit more information on that. Of the 1,145 cases we reported yesterday, in that number, 146 of those were people who were hospitalized. So we reported 1,145 cases of those people who had tested positively for COVID-19, but only 146 persons were hospitalized as of yesterday in that total number. So again, just trying to drill down a little bit more to kind of provide you with a little bit more information on the numbers that we are providing to you. So we know things are working. The overwhelming majority of people are self-isolating and self-isolating at home and recovering at home. And a new report from the Kinder Institute shows additional positive news. This is the Kinder Institute at Rice University. Based on their study, estimates show that the Stay Home, Work Safe order in the city of Houston and Harris County are preventing deaths and hospitalizations. Their estimates show that social distancing measures during the 14-day period between March 24th, when the order was issued, and April the 6th, have saved the lives, in their report, in their study, 4,533 Houstonians, and kept another 48,812 from being hospitalized locally. That's from the Kinder Institute and their study. The report goes on to say that if we continue this path, by April 22nd, we could save 13,220 lives right here in the Houston-Harris County area. So the message is very, very clear. Social distancing works, and April is a critical month, and we cannot get complacent. Let me also provide some other good news. As you know, over the weekend, we got word that our federal health partners would be pulling out by April the 10th. And that also would impact the PPEs provided by the federal government. Just got confirmation today that they are not going to pull out, that they will continue to remain in the city of Houston through April the 30th. And there were 3 persons at each one of our testing sites, 6 in total. But what is more important is that the PPEs will continue to come, and that the federal government will continue to assume 100% of the cost. So it won't be a cost share of 75-25. So just got confirmation on that, that the federal healthcare workers will continue. The PPEs for the testing sites in the city of Houston will continue, and the federal government will continue to assume 100% of the cost. And I want to give special credit and acknowledgement to our congressional delegation. I want to thank them. They were very, very active in advocating on behalf of the city of Houston. So let me give a special acknowledgement to our congressional delegation. Let me thank Chief Art Acevedo as well. I know he was active on the phone, working his connections also in D.C. Want to thank him. Want to thank Dr. Peirce and Director Williams and the Health Department for their work in making this happen. And so that is good news. And I think that's an excellent way to segue to Dr. Peirce.
Thank you, Mayor. And yes, that's excellent news to hear. So that's going to help us with our testing and maintain that capacity for folks that want to get tested. A couple of other things I want to point out that the mayor touched on is that the social distancing works. We had a graphic here yesterday that showed that the impact that one person, by just reducing the number of folks that they could potentially infect, and remember, the phenomenon of asymptomatic or pre-symptomatic spread, which is unique to this virus, is real. That's why so many of us are wearing masks, so we don't accidentally spread it. But if one person were to infect 2.5 people, which is the estimate of what one person would routinely infect without social distancing, that within a month that comes to just over 400 people would be infected. If they were to cut it in half, from 2.5 people to 1.25 people, it drops down to about 30. Okay, that's greater than a factor of 10 reduction. So social distancing is incredibly important. That having been said, because you're wearing a mask does not mean you don't have to social distance. The social distancing and the mask are 2 different strategies or 2 different techniques. They work with each other, but one absolutely does not replace the other. So we have to do both. And the third thing I wanted to remind folks is that with testing, it is a test to see if you happen to be infected on that day. I continue, even though we've talked about it many times, I continue to hear people say, I need to get tested so that I won't get the virus. That is wrong. It is not a vaccine. If you get tested and you're negative that day, and we're seeing that people aren't getting the results for 4 or 5 days, sometimes even more, you could become infected again. This is why it's important that people understand the function of testing. So social distancing, wearing the masks, testing, 3 different strategies, all aimed at the same goal, but no one replaces the other. Thank you, sir.
Thank you, Dr. Peirce. I also want to, and let me acknowledge this, Mayor Pro Tem Dave Martin, Vice Mayor Pro Tem Martha Castek-Tatum, and Councilmember Edward Pollard. So I want to thank all of them and the entire city council members because they have just been very supportive. This is a team effort, and I want to thank them for all that they have been doing and continue to do. I also want to thank Flowtech Industries for donating 1,240 gallons of hand sanitizer, 191 gallon bottles with pumps, 210 5-gallon bottles with spigots and an estimated value of $43,000. And this donation to the city was done in partnership with Tudor, Pickering, Holt and Company through Flowtech Energetic Foundation. And we have representatives here today, including John Gibson Jr., the CEO, Flowtech Industries, and he's wearing his red shirt, which means that he is a University of Houston Cougar. Now, no favoritism at all, but he is a University of Houston Cougar standing in front of that Longhorn on that poster board right behind him where it belongs. And then also is Byron Pope, the Managing Director of Tudor, Pickering, Holt and Company. Byron, where are you? Thank you as well. And representatives from Flowtech. This is a good time to remind everyone that the City of Houston, the Astro Foundation, Cheniere Energy, and Project Cure are hosting a PPE donation drive tomorrow from noon to 3 at Minute Maid Park. And I want to say to Flowtech before they move to the side, this is what Houston is all about. We have some fantastic partners, people who are stepping up each and every day and providing essential supplies for our first responders and healthcare providers. And quite frankly, the City of Houston could not afford to do it just on its own. So let me thank you all again from the very depths of our hearts. Thank you. Thanks, John. And so bear in mind that the supply drive, the PPE supply drive, is tomorrow from 12 to 3 at Minute Maid, and we are asking for new, unopened, including N95 masks, surgical masks, face shields, gloves, surgical and isolation gowns, protective coveralls and shoe covers, and hand sanitizers containing 70% alcohol. And the city will distribute all donated items to personnel at the COVID-19 mobile testing sites and to first responders and essential municipal personnel operating the Houston Parks Department, the Meals Distribution Centers, and the Mayor's Office of Homeless Initiative. So I want to thank you all for that. And then also, again, want to remind you about Thursday at noon, wherever you are, just pause for a moment of prayer, silent meditation, whatever you want to do. And it's totally interdenominational, so it's not just based on any one faith. Passover starts this week as well. So wherever you are, at noon, wherever you are, just pause and for a moment of silent prayer and meditation. Now, having said that, let me pause. Chief Pena, any additional report today?
Sure. Thank you, Mayor. Good afternoon, everyone. I have a quick update on the status of the personnel for the Houston Fire Department. At this moment, we have 165 personnel in quarantine. That's down from 220 yesterday. 23 of those are in a city-leased facility, and they're doing well. Unfortunately, we do have one firefighter that has been admitted to the hospital. He was had not been admitted to ICU, but today, this afternoon, I got word that he did get admitted. He's breathing on his own. He's on oxygen, but he's not intubated, and we hope for a full recovery. If you can please keep him and his family in your prayers. We have, through the course of this operation, we've had 20 firefighters that have been tested positive for COVID-19. 9 of those have since come back, so we have 11 currently that are positive. And in the course of the operation, we've had 128 firefighters who have been quarantined and returned to work. In regards to the compliance to the stay-home order, we've had, in the last 24 hours, we've had 134 responses to complaints of facilities that have theoretically not complied with the stay-home order. Thankfully, our task force has been able to get them to comply with the order. We have not cited any business at this point. Any reports should go through 311. They will be routed appropriately. The facilities, the structures, are the responsibility of the Houston Fire Department, and any outdoor enforcement falls on the Houston Police Department. But as the mayor mentioned earlier, this is a team effort. We need everybody to participate. If some people don't participate, it doesn't work, okay? Just like we can't rope off a P section in the pool. everybody needs to ensure that they're doing their part in order for us to get through this efficiently. Okay? Thanks, Mayor.
I didn't quite understand that last phrase of that, and I don't think I'm going to don't think I'm going to interpret that last phrase, but we got the gist of what you were saying, Chief Elia. Okay, Chief Acevedo.
Thank you, Mayor. I'm going to start off with the update on our personnel. We have currently 130 Houston police members that are quarantined. We're down to 99, which is a good news. We keep trending downward. Classified sworn officers and 31 civilians. We have a total of 130 personnel that have been tested. 126 sworn classified, 24 of those have come back positive, 51 negative, and 51 pending. Civilians, we remain at 4 tested, 1 negative, and 3 pending. Return to duty, so far we have 5 officers that have returned to duty after testing positive for COVID-19, which is a really good thing. We do have 1 officer that still remains fighting hard in the hospital, in ICU, on a ventilator, and we continue to ask for prayers. Again, yesterday, I was able to report that he's improved, but he's still in a fight, and we just, again, whether you just send good thoughts, whether you believe in God or not, send good thoughts to him and his family. I tried, Mayor, but I can't do it. Oh, here we go. I can't see, sorry. Okay, here we go. Let me give you an update on crime as it relates to what's been going on. Regarding burglary of buildings, comparing post-COVID to the same time frame in 2019. So we're looking at the same time frame in 2019 to 2020. Burglary of buildings are up 17%, and comparing pre-COVID and our stay-at-home essential function order versus post-COVID, we have time frame in 2020, burglaries of buildings are up 25%. With regard to aggravated assaults and domestic violence, we looked at our arrests to determine if our arrests were keeping pace with the increased incidents in this area. Let me bring that up now. When comparing equal time periods immediately before and after the implementation of the COVID-19 restrictions, aggravated assaults are up 25%. Family violence, aggravated assault are up 35%. And again, that speaks to people being, I think, sheltering in place, people not giving themselves room, people just getting the pressure of losing jobs and everything else. And again, to the families that are feeling the pain, just remember that physical violence is never acceptable, and more than ever, we need to give ourselves some space, and quite frankly, we need to ask for help. Reach out, call us, call 311, call 911 to the victims and the families and those struggling, to know that we're here for you. When comparing post-COVID time frame to the same period in 2019, aggravated assaults are up 84%, family violence, aggravated assault charges are up 79%. That is very disturbing. So we need to, again, keep the faith in each other, and understand that physical violence is not the answer to the struggles. And let me just close by saying, Mayor, that we're so blessed to have such a generous community that gives so much to the men and women in blue and our firefighters. But I would just ask those that, if it's not PPEs that we need right away, but for us, we're blessed that we're still working. And keep in mind that we're going to have a lot of other families and a lot of other needs, and that's going to be more long-term. So keep thinking about the other folks that are going to need help in the upcoming weeks and months. And that's my report for now, Mayor.
So you've heard the reports from police and from fire, and then I also want to remember our municipal workers. We have had 28 municipal employees who have tested positively. And again, I want to also give a very special acknowledgement to all of our municipal employees that are working, from the health department to housing and community development to Department of Neighborhoods, all of the employees, HR, you name it, and because they are working, they are out there, public works, all of these employees, municipal employees. So let me give a special thanks. So you know about tomorrow, 12 to 3. But I do want to give a special acknowledgement, because it was Councilmember Edward Pollard who came up with the idea with pausing on Thursday, 12, for a moment of silence or a moment of prayer. So Councilmember Pollard, why don't you want to emphasize your idea?
Thank you, Mayor. City Council, the Mayor's Office, our first responders, police, fire, medical professionals on the front lines, we're all doing all that we can to keep our city safe and to save lives. But to that end, regardless of what your faith is, your beliefs, we all need to have faith. And Houston is known to be Houston strong for a reason. When crisis hits us, when storms come our way, we band together. And so it was my intention to come up with a day of prayer that we collectively as a city come together on Thursday at 12 o'clock, wherever you are, pray. And if you don't have a particular faith, we ask that you observe a moment of silence. And if we all come together, we'll get through this. This is all about saving lives. And I thank the mayor for having my back and supporting me on this effort, and all the frontline medical professionals, first responders, and city council for supporting this as well. So thank you all.
Thank you. And again, this week starts also Passover for the Jewish community, very, very special celebration in which their departure from Pharaoh. And so we certainly want to bear in mind and lift up the Jewish community. In fact, all communities of faith, so we know this is a very special week. With regards to our parks, let me just say this. We are keeping the parks open, but I do want to underscore this. And I've said to the park rangers, if the parks get crowded, if any one of the parks get crowded, where people are not engaging in social distancing, they do not have to call me or the director. They have permission to shut down that particular park right there on the spot, okay? So if you go to a park and it's crowded, go to another one. If you go to another one and it's crowded, then go to your neighborhood and kind of walk or run in the neighborhood. But April is the month that we all need to be very intentional. Stay at home, engage in social distancing, wear your mask, because if we do this together, we can break the back of this coronavirus, COVID-19. Now, having said that, we'll take a few questions from you at this time.
Mayor,
Yes.
City and county leaders at a point right now where they can start to have discussions about lifting this stay-at-home, work-safe order?
No. No, not. I think the collective focus needs to be on staying at home, engaging in social distancing. And I think you've heard the reports across the country. In fact, I think we are probably, and Dr. Percy maybe can speak to it even better, I think we are probably maybe a week or two, couple of weeks behind New York or some of those other places. And as you can see, as long as our numbers continue to rise, then we have not reached the peak in the city of Houston. We have not. So even though, relatively speaking, our numbers are lower, okay, we are not yet ready to talk about ending stay home, stay safe. April, the entire month of April, we need to be very, 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 very focused in really doing everything we can to mitigate the risk of this virus and to stay within our healthcare delivery system capacity to handle the cases. All right.
Mayor, can you guys talk about, yesterday there was 402 cases.
Yes.
How many tests are still outstanding? Maybe Dr. Pearce can talk about it.
Yeah.
How many are we still waiting for? And then I know you've talked in the past about, you believe the number of cases out there is like 5 to 10 times what is actually listed. Can you talk about that issue along with the testing? Yeah.
You're asking the question that frustrates the mayor, I know, because I've heard it more than once. But part of the problem is that the good news is that there are a lot of places out there that are doing testing. The bad news is they are only obligated to tell us about their positive results. They're not obligated to tell us of their negative, nor how many they have outstanding. And so we don't have that information. So when you ask the question, one thing I would like to know is, of all the tests that have been done, what percentage have come back positive? Well, we don't have the denominator for that, right? So it makes it challenging. The good news is that there is more testing coming available. And the other good news is that the federal government has decided to continue to support our efforts. And so to some degree, while it's frustrating, we don't have the denominator, and we don't want to get hung up on the numbers. You said that a dozen times. But, as long as we are continuing testing and we're tracking the number of positive cases, we have some idea as to what's going on in the community. And then the other thing is we're developing a good relationship with the hospitals, because that's actually an even more important. Like how many patients are in the hospitals and how many are in the intensive care units. So we're getting that data. We don't have it quite yet because it's very complicated to get that. And I will explain just briefly is that, within a hospital, there's dozens of different kinds of hospital beds. And there are some patients that they know have got it, some patients they think might have it, and some patients they're pretty sure don't, but they're testing anyways. And so getting the data is very, very complicated. So that work's being done.
And I think if I can elaborate on just a bit further, we don't know. We know there's that backlog, and then they come in like in bunches, like yesterday.
Yeah.
And that's why, we spend time to let people know it wasn't like the day before we tested and we had 402 cases all of a sudden, and the day before was 53. That number went back to mid-March. But what I can say to you, of that total 1,145 cases as of yesterday, only 146 of that number were hospitalized as of yesterday. I can tell you that. So most cases, for most people, they were self-resolving their situation at home.
But you believe there's like thousands more out there who's just not.
And I'm sure there are thousands more. But these are the things that I look at. Are the hospitals, as of today, able to handle the load without going to an internal surge capacity? And the answer, as of today, is yes. Okay. Are there enough ventilators? Yes. Are there enough ICU beds? For today, yes. Of course, that could change tomorrow. In 48 or 72 hours, that could change, but for right now. And then what's also instructive for me, and I hopefully it'll be instructive for other people as well, when you see the number of deaths that's been reported across the country, let's say close to 11,000, how many deaths have been reported in the city of Houston? Whether they were tested, not tested, whether you're in hospital, not in the hospital, the number of deaths have been reported as of today in the city of Houston. That number is 11. So that's instructive for me. Now, it also says, for me, that we have some outstanding hospitals, and because they have the ability to provide the care that they need to the people who are coming in, we're addressing their situation. I do want to acknowledge Councilmember Sally Alcorn. Thank you, Councilmember. Appreciate all the support that you've been giving to all of us in the city of Houston. So thank you so very, very much.
Can you talk about, Mayor, and I don't know if you guys know the statistics yet of the 11 deaths, but in cities like Detroit and in Chicago, they've talked about the racial disparity, the fact that a majority of the victims are African American who passed. Can you talk, what do you know or not know?
We're drilling down on those numbers. We just had that conversation even as late as 30 minutes ago. We're having that conversation. Let's say we take the 11, and then we're look at the details on that 11. So what we're wanting to know is not just the age, the gender, but also the racial makeup of the individuals. Not just those who have died, but those also who have been tested positively for COVID-19. So we are drilling down on those numbers.
Do you feel like, and just to follow up, that was another station's question, but my thought on that was like, do you feel like in Houston, I mean, we have such a diverse population that the minority and the less affluent communities have had equal access to testing? Do you believe that they're, whatever their positive or number of testing, they're getting an equal representation?
Well, what I would say to you, with or without COVID-19, the health disparities have always been there. They were there before COVID-19. They are accentuated with COVID-19. But we saw that not just with COVID-19. For all of us who went through with Hurricane Harvey, we saw those disparities even with Hurricane Harvey. For people who are already on the margins, Hurricane Harvey pushed them down even further. Okay? And it's taken them longer to recover, and they are more impacted. The same thing now applies to COVID-19, especially when you look at your vulnerable populations, people who are in low-income communities, people who have underlying health conditions, hypertension, diabetes, renal failure. All of those things will help to accentuate their situation. So when you are already marginal, or your resources, your access to health care is already limited, you don't have the means. There are many, many people, for example, that may not have the ability to drive themselves to the testing sites. So they are limited by where they geographically live. And we have talked about trying to increase the ability of our testing so that we can go to the communities, get closer to the communities where people are. And Director Stephen Williams brought that up today, and he's working on a plan to kind of get us there. Now that we know, for example, that our federal health partner will be here at least through April the 30th, and we don't have to worry about the cost share on the PPEs for those testing centers, it might provide us with a greater ability to try to find ways to extend testing into many of these vulnerable communities, like on the East End, or in Sunnyside, or in Fifth Ward, Acres Home, all of these other areas that exist.
And can you emphasize to us again how consequential the Kinder study was? You said it was like 4,700?
Yeah, the Kinder Institute, their study that they put out, let me get my numbers again. Hold on one second, if you don't mind. I think I can speed it up if I do this. All right. Basically, what the Kinder Institute and what they said in their assessment was that their estimates show that social distancing measures during the 14-day period between March 24, when the order was issued, and April the 6th, which was yesterday, they said have saved the lives of 4,533 Houstonians and kept 48,812 from being hospitalized locally. And the report goes on to say that if we continue this path by April 22nd, we could save 13,220 lives, and that's in the Houston-Harris County area. Now, if people want to know whether or not staying home is worth it, whether or not the sacrifice is worth it, this is one study, the Kinder Institute at Rice University, that's saying it is worth it. And if that doesn't convince you, you take a look when you go and you pull up the number of deaths, people who have died in the United States from COVID-19, and when you see close to 11,000, or whatever that number is as of today, and then with the city of Houston, 11, that should speak loudly to you as well. So what we are doing is working, and I want to thank people in the city for complying, and that's why in the month of April, and let me apologize to you in advance, in the month of April, if we see that you are gathering in large crowds, we're going to break it up, okay? I just want to apologize to people in advance. I don't want people calling me and saying, Mayor, people are being heavy-handed. No, we're just trying to save your life or the life of a friend or a family member or someone else. So in the month of April, we want to be very, very intentional. Stay home. If you're at essential businesses practice safe, work safely. And if you're going to the grocery store, 6 feet apart. And if you have any problems with that, take a look at that longhorn with the horns. It kind of hurt me to say that, longhorns, but coming from a cougar. One thing about COVID-19, it pulls you all together. Longhorns and cougars and rice owls, we're all on the same page fighting COVID-19. The TSU Tigers, we're all on the same page. Anything else? All right. Thank you all so very, very much. Appreciate you.